Hello, I'm Ellen Coulter. In the ABC's Hobart newsroom, we've been taking a look at the problems gripping Tasmania's biggest and busiest hospital, the Royal Hobart. Emergency department wait times are blowing out, ambulances are increasingly ramped, and it's becoming very apparent that the opening of the first stage of a major redevelopment in September isn't going to be the answer to all of the hospital's woes. State political reporter Rihanna Whitson spoke with two patients about their experiences at the Royal Hobart Hospital.
It's been a long road to recovery for Gale Reynolds. Aided by family, the 70-year-old spent the past 9 months recovering from surgery to stop the spread of gangrene in her feet. Her left big toe was amputated, along with part of her right foot.
I was hoping I'd have got it done straight away, then I wouldn't have lost all my toes. But they left it far too long.
The operation could have been done sooner. Her family, who the ABC first spoke to in October, are still angry. Pressures on the Royal Hobart Hospital meant her surgery was cancelled 3 times and eventually performed at the Launceston General.
Something has to be done. Otherwise you'll see more people like Mum.
Patients should come first.
Ms Reynolds now gets around with a walking stick, wearing a large slipper boot, big enough to fit over her bandages.
Her niece lives across the road. She can't even go over there without help.
In March, Jake Vincent suffered 2 strokes in 5 days. On the 22-year-old's first emergency visit to the Royal, he immediately received the life-saving treatment he needed. When he had his second stroke, things didn't go according to plan.
Where I sat on the ramp in the ambulance for about half an hour. I then was put into the emergency waiting room, and I was there for about 6.5 hours.
During that time, Jake says he had 2 CAT scans which found a clot in his brain. Hours later, he was assessed by a worried registrar doctor who organised for Jake to be flown to the Royal Melbourne Hospital.
To the registrar's credit, she was on the phone straight away, and within an hour I was on a flight.
Jake wouldn't wish his experience on anyone else.
Having lived that reality, it is quite frightening that people are, if not dying, their effects of what's happened to their body physically and mentally are definitely prolonged.
2 stroke experts the ABC spoke to about Jake's story said due to the time-critical nature of strokes, even just half an hour ramped in an ambulance or waiting several hours in the emergency department could be deadly.
A hospital spokesman has released a statement responding to that story about Jake Vincent. He says the patient was seen by a doctor within clinically recommended timeframes, and any suggestion that he wasn't triaged or treated appropriately is incorrect. When patients don't receive the care they need at the Royal Hobart Hospital, the pressure and the stress is also felt by nurses, doctors and paramedics, and they say they're struggling to be the faces of a failing hospital system. After 14 years as a paramedic, Emily Byers is knocking off from increasingly stressful shifts. She's picking up more patients with more complex issues, and when she does deliver them to the Royal Hobart Hospital, there often isn't a bed.
Ramping used to be fairly rare. Certainly when I first started, very rare. Now it's a daily occurrence. There's not a day that goes by at the Royal without ramping.
Ambulances ramp outside the emergency department when there's no bed available, and patients are left in the care of paramedics like Emily, usually in a corridor. It means she also can't attend other call-outs.
The feeling of frustration and inadequacy of being able to do your job at that time because you're effectively trying to cover the failings of a health system is it's a bit soul-destroying, really.
A recent Auditor General's report found that in the past 5 years, the instances of patients waiting more than half an hour to be offloaded from an ambulance rose from 2,200 to more than 7,600, an increase of 239%. In the 9 months to March, patients at the Royal were held in ramped ambulances for almost 10,000 hours. Tristan Streefland deals with patient flow inside the Royal. He's worrying about the shift well ahead of his arrival at work.
Sometimes you're going a bit apprehensive when you have days off because you have no idea what you're walking into.
He coordinates patients coming from the ED into the assessment and planning unit and then being discharged. When the hospital is at its most extreme level of stress, level 4, the pressure is intense.
How quickly can we get this patient around? We've got ambulances ramping. We've got calls coming from our senior management as well saying, what's the hold up in getting your patients out of your unit? What's the hold up? Why can't you take these patients out of ED? We're getting pressures from the patients.
Tristan says many of his colleagues feel burnt out and deflated.
There's call bells left unanswered for periods of time because we just can't get there, or someone needs help going to the toilet and sometimes we can't get there in the time that they need.
He's expecting some relief when the Royal's new K block opens in September, but there's also increasing demand. Between mid-2009 and mid-2018, emergency department presentations at Tasmanian hospitals increased by about 21,000 people, or 14.7%. The Royal Hobart Hospital saw a 34.3% increase. The increase in emergency department presentations in Tasmania has been lower than in every other Australian jurisdiction, but it's complicated by Tasmania's older population, low rates of health literacy, the burden of chronic illness and limited private emergency services. And the growth in demand from complex patients is only anticipated to increase over the coming decade. Health policy experts say they've known for decades how to fix the problems, but a two-tiered system of federal and state health funding has made hospital reform difficult. Guy Stainer has taken a look at some of the possible solutions to Tasmania's hospital crisis.
It's a familiar sound as more patients are collected and brought to the Royal Hobart Hospital, only to be confronted by unacceptable delays. The quick fix is simple but expensive.
The major cause of that block is lack of beds, so the major way to fix it is going to be opening up more beds.
The Royal's new K block is nearing completion, but there are concerns there may not be enough doctors and nurses to staff the new beds.
That's going to require a major recruiting effort to get the nursing staff and other clinical support staff that we need to open 100 extra beds in the THS over the next year.
Major reform at the hospital may require changes at a national level.
If we had state and Commonwealth joined in one system of management where they had to make decisions with each other, not separately, we could change a lot of the pressures that we're seeing in the health system. It is the source of most of the health pressures.
Professor Rosemary Calder has analysed every national review of the health system over the past 40 years. She says each review has recommended national stewardship to oversee the health system, and every one of the 16 reviews has been ignored.
We continue to commission reviews and we don't put into play the advice that we get back from them.
Another major source of frustration is the lack of funding to prevent the chronic diseases that choke hospitals, particularly in Tasmania. Australia spends just 1.3% of its health budget in preventative health care. New Zealand spends 5 times that amount.
The Public Health Association would like to increase that to about 5% of the budget.
Advocates say increased preventative spending won't produce immediate results, but would have a huge impact for generations to come.
The studies show that better preventative care would reduce emergency department presentations by up to 30%.
Time is ticking, and the experts say the longer we wait, the worse it will get.
The Health Minister, opposition parties and emergency medicine experts are all trying to come up with ways to improve access to emergency care and make sure Tasmanians can access the hospital beds they need. For patients and health workers, the answers can't come soon enough.